The topic of tonight's live stream is better than Botox. I'm going to talk specifically about AGNES radiofrequency, which is a treatment we can use to rejuvenate the very delicate around the eye region. So we're going to focus on AGNES's applications for the eye region, although I'll let you know a little bit about what else it can do in other areas of the face. My name is Dr. Lisa Vuich. I'm the owner of Renew MediSpa and the Renew MediSpa Training Institute. And as most of you probably know, we specialize in non-surgical aesthetics for the face and the body, and also on sexual wellness procedures and on training nurses and physicians to perform the procedures that we offer at Renew MediSpa. So tonight I'm going to speak about a couple different categories of things. One is, what are the general upper face concerns? What are the reasons why people see us with concerns in the eye region? And what categories of treatments we have available for that area? I'll show you where these various treatments overlap in terms of what they can do, and also in where they stand out and the different things that you can expect from one treatment but not expect from another. And hopefully this will help you dial into what it is you might want to consider having done based on what your specific concerns are. And of course, I'll mention with respect to AGNES, how to prepare for the procedure, who's a candidate for the procedure, and what kind of downtime you might expect. So when it comes to the upper face, as you can see in this photograph, there are a number of things that might cause someone to seek interventions at a medical spa when they're talking about the region around their eyes and what they don't like. We start with the frown lines, we call them. Those are the lines or the angry 11s that are between the brows. You see there in the middle of the photograph. Another set of lines that often bothers people is what I call clown lines, or those stacked little lines that can appear especially over the tail of the eyebrow, which you see pointed out with an arrow there. Those are difficult to treat. You really can't treat those effectively with Botox, so those are often a concern. Next, we certainly have issues with loosening and crepiness of the skin, which is under the eyebrow, and that often overhangs and can even completely overshadow the actual eyelid proper and even rest on the lashes if it's really severe. So we call that loose skin, or what you might call hooded eyes. The standard crow's feet, which are the lines out on the sides, out in here, these are typically called the crow's feet. And then it's also important to understand that some of the lines around the eye are what we call static lines, as I pointed out with that arrow a little bit further down on the page there. Static lines means lines that are present even when you're not actively smiling or making a facial expression. And so those static lines are the ones that are not going to be helped as much with something like a Botox, which relaxes muscle. Moving down, we have the tear trough deformity, which basically refers to that little gully or gutter type space that's sometimes present under the eye. And then, of course, the under eye bags, which are actually little fat pads that can become more prominent in some people with increasing age. And when those start to protrude and stand out, we call them eye bags, and those are certainly a cause for concern. So all of these changes that can occur around the eyes certainly contribute to someone looking more tired, less refreshed, older in general. And we have different tools in our toolbox to address each of these concerns. And there's some overlap, so that's what we'll go through today. Now, brow position is often also another concern. As you can see here in the photograph on the left, one brow is lower than the other, the one that's the patient's right eye brow, which would be on your left. If you look back and forth, you'll see that that brow is lower than the brow over the opposite eye. So that is something where if we can correct that asymmetry, that can also be very helpful in terms of making the eyes seem like they're opened up, more awake, more alert, and more refreshed. So we call that brow ptosis if one or both of the brows are dropped. And then lastly, mid-face volume loss. So very often, in order to rejuvenate the under eye region, we also have to address volume loss in the cheeks. So if you look in this set of photos here, if you go from left to right, back and forth, what you should notice is that the eyes in the image on your right look to be more open, a little softer, more awake or alert. And really all that's changed there is the brow position has been brought up a little bit. That's pretty much it. And also they've put some filler in the cheeks, I believe, and also in the temporal hollows. So that's where the white arrow is pointing to that depression or temporal hollow, which is a depression that can form behind the brows or behind the eyes and certainly make the upper face appear to be older. So again, going from left to right on your screen, what's been done is volume correction and also something in order to lift that brow. So these are all perfectly reasonable rejuvenation goals for the upper face. Forehead lines can be very tricky even with Botox. We are very often reminding patients that the only way Botox works, and when I say Botox, I mean the term generic generically, many different brands, but botulinum toxin. The only way it works is to relax muscle. And at the same time, the only muscle lifting your brows is your forehead muscle, or that frontalis muscle pictured in the diagram there. So the more you relax the forehead, trying to treat those horizontal lines, the more you run the risk that your brows and perhaps your lids will actually drop, because when this forehead relaxes, things can fall down. So we're often in a tough situation when it comes to forehead lines where we want to improve them, but we can't necessarily do that well with a muscle relaxer, because then we get side effects that we don't want, such as lowered brows or flattened brows. Forehead Botox also comes with some additional pitfalls. If you use not enough tox, you may actually get what's pictured on the left there, or a highly peaking brow. That means the center of the forehead is relaxed, but some strip over one of the eyes is still abnormally active, and it's giving that peaked look to the brow. So that's an indication that the Botox didn't have quite enough of an effect over the raising brow. On the other hand, it's also possible, as I mentioned, that you might get too much Botox effect if you're treating forehead lines with Botox, and your brow may actually drop. And as you can see there, you could imagine this person might have gotten a little bit too much Botox on one side so that their brow dropped, and now the lid is hanging lower, or you might say the eye is a little bit more hooded. So these are the two pitfalls we get into with Botox when we're trying to treat forehead lines by relaxing muscle. So in facial aesthetics, to summarize, Botox is really the prime example of a one-trick pony. It really only relaxes muscle. There's no other mechanism of action really that's significant for it. And so we get pretty easily trapped in terms of hitting a limit in terms of what we can actually do with it. It's important to understand also that Botox doesn't fill a line. It's not actually even stimulating collagen. So we have to look towards other techniques if we have lines that Botox cannot help us with. And that's what we're going to get into tonight. And as I mentioned, when we say Botox, we tend to use that Botox generic term. There are actually multiple brands of botulinum toxin that are on the market. You can see them listed there at the bottom of this slide. Dysport and Jeuveau are two of the most popular at Renew, but there's also the original Botox made by Allergan. There's one called Xeomin made by Merz. And there's finally another one coming to market this fall, which may actually have a longer duration of action. So many choices there when it comes to which product. Now, dermal fillers certainly help us around the eye, as I started to mention earlier, but dermal fillers, understand, only smooth by adding volume. So they're not relaxing anything, they're actually plumping. And that too can only get you so far when we're talking about treating around the eye. If we look at this before and after image here, you can imagine that most likely what was done is tear trough, a filler was placed in the tear trough or in that depression. And as you can see, that actually led to some improvement in the shadowing that was happening there. So things look better in the under eye. But notice that the fine lines, that the crepiness doesn't look better. So filler really isn't going to help you so much with crepey under eye or eyelid skin. Now, if you look really closely, you'll see that they probably put a little bit of filler in the crow's feet for this patient. You see that sort of effaced or softened there in the bottom picture. And you can almost imagine that you can almost see the ridge of filler that they put into each of those crow's feet marks. So sometimes you can see a residual irregularity from filler if you are tracing a very fine line with it. So it's not something we never do, but again, that will be somewhere where you'll hit some limits in terms of what you can achieve. So some patients might be very happy with a correction like this. Others might say, but I still see crepey skin. I still see fine lines. What else can I do? And what about my lid that's dropping and covering up part of my eyelid? What can I do about that? Because I really don't want to have surgery. So these are questions we get all the time at Renew. One trick I've mentioned before on prior videos is that we do have something called PDO Smoothing Threads. These are tiny little threads loaded on tiny little needles, as you can see here. They're very fine surgical suture material, which does dissolve over the course of 3 months. But for the 3 months that they're there, they will stimulate collagen wherever you place them. So this is a fairly quick and easy procedure to do. We can't do too much with it for upper eyelids or things like that. But in something like the glabellar lines, these angry 11s, frown lines, or in forehead lines, PDO threads is an option as well. So let's look at 3 different potential treatments, and I'll compare them for you in terms of what area they help us in most. So with respect to Botox, As you know, 3 to 4 months of duration is pretty average if the dose was good for you. Now, that can improve the lines between the brows, right? So zone 4, you'll see improvement in glabellar frown lines. That's a yes. Duration of effect, 3 to 4 months. However, Botox cannot help tighten the skin under your brow. It can't really tighten or smooth the skin much under the lower eyelid, although sometimes tiny little doses are sprinkled there, but it's going to have a very limited effect. It will have a subtle effect on lifting your brows if it's put in just so in order to give you that. But as you can see, it's pretty limited. Those clown lines, remember I mentioned over the tail of the brow, very limited improvement you can get with Botox. So that's pretty much that. Looking at PDO threads, or the middle column next, duration of effect is really going to vary according to what types of threads and how many you're using. So that's pretty variable. But again, you'll notice PDO threads are not going to help you in that zone number one, that skin under the brow. They may help you. We've talked about eye threads before, the little ones that I can put in this skin here. Multiple procedures over time, you can build collagen that way. It will be slow, but it does happen. Are threads used for brow lifting? Yes, we do have some lifting threads we can pick the brow up with. So that is an option, but it will be something you probably have to repeat twice a year. Can they improve the frown lines? As I said, yes. Can they improve the lines directly over the tail of the brow? Yes. Those threads can be put into those lines and can definitely improve them over time by stimulating collagen. But again, they're dissolved at 3 months. AGNES RF gives us an option to treat multiple areas around the eye, multiple different problems all in one procedure. So that's really where it stands out. Duration of effect now is going to be years because of the amount of collagen that's produced by these procedures. And finally, yes, with AGNES, we can tighten and smooth the skin under the brow, zone 1. We can also tighten and smooth the skin under the lower lid, zone 2. We can soften and eliminate, ultimately, crow's feet in zone 3. So you see now we're suddenly able to treat all of those zones all with one device. And we can also dissolve unwanted fat cells in those under eye bags or under eye protruding fat pads. So that is something that PDO threads and Botox really don't help us much with. So you can see it's pretty versatile. Now, microneedling with RF is not anything new. We brought the AGNES device in January, but we have done microneedling with RF at Renew for many years. What varies with devices for microneedling with radiofrequency really has to do with the size of the handpiece, the shape of the handpiece, how many needles the applicator has. As you can see, some of these that I've listed here, like Vuich, Morpheus, Secret, Scarlet, Lutronic Genius, Profound RF, you can see how large that handpiece is. So something with that large a handpiece, it becomes difficult to work around the eye, and you can't really treat that under eye fat pad with something so large. So we have had the Lutronic Genius at Renew for some years. We've had Profound RF even longer than Lutronic Genius. They're very popular procedures. We tend to treat full faces and even body areas because the applicator is a really nice size. But for the delicate area around the eye, these devices don't help us as much. Now contrast that with the handpiece, as you can see here, of the AGNES, which is literally like holding a paintbrush. And there are a number of different needle types, as you see that we have here. And we'll select the needle type based on whether we're smoothing, tightening, destroying fat cells. Treating acne is another thing we can do with AGNES. So depending on what we need, we just swap out the different needle, change the settings, and now we can do within one procedure many different areas of treatment. So at Renew, AGNES is performed by myself and by currently 2 of my nurses, by Victor and Heather. And you can see here image Jeff, our practice manager. The picture on the right is what his periorbital around the eye region looked immediately after treatment. Now that's before any icing took place. And now I will see if I can play for you a video of the procedure happening here. Gonna be okay with that? Mm-hmm. Okay. So this is tightening the skin under the brow. Do a couple rows here, and then we'll do the lifting. Feeling much other than pressure?
No.
Any heat?
No.
Okay. Have you ever done any tightening treatments here before? Skin tightening?
In the eye area?
Yeah.
No.
Feeling anything?
No.
No?
No.
Good. Doing okay?
Mm-hmm.
So typical treatment zones around the eye you can see here, and also we treat around the mouth, as you can see. Depending on how large an area we're working in, there would be a different price. Sometimes we're treating crow's feet only, so just the side. That's the first option. Another option is to treat the brow to get that up and to tighten the skin under the brow. Or you can treat full periorbital, as you see there. Full periorbital, we also have an option that includes the fat pad minimization or fat pad destruction, if we're doing that. And also vertical lip lines, you can either treat just the lines top, you can treat the lines top and bottom, or we can do a full perioral treatment, which generally brings us out to the sides here so that it's a full oral rejuvenation. And as I mentioned earlier, jaw lines also. We're able to destroy fat cells in the heavy jowls. We're also able to destroy fat cells in the so-called double chin or submental region. Again, all with the same device. So when we're doing a consult with Agnes with one of our clients, we're helping them decide, well, how large an area do I want to treat? In what order do I want to treat my areas? And basically helping you lay out the treatment plan. I'm going to show you now some examples of progress results. Now, these happen to be results just made with one session of the Agnes. Most clients who come to us are going to need potentially 2 sessions. It's possible someone might even treat an area 3 times. What really determines that is how much collagen loss there is to begin with. And then, of course, not everybody makes collagen at the same rate when you stimulate them, even with the same treatment. So someone who is older, perhaps, or has more sun damage, has very deeply etched lines, might need 3 treatments. Someone who is younger or has lines that aren't as deep, not as etched, might be just fine in an area with 1 treatment. You may also elect to do an initial treatment where you do a larger area. So, for example, 1 treatment might be full perioral, and then once that's had time to work, might look at that in 3 months and be like, you know what, everything looks great except just above the upper lip needs to be treated. Then we'd go for that. Same thing with the eyes. We've had some clients where they started out doing the full periorbital, so treating everything. And then for their second treatment, they opted to either just treat the crow's feet or just treat the under eye because things were already so improved in some of the regions that they treated. Here is 1 month progress after a single treatment. You can see the treatment zones marked out. The green was basically the under eye with a little bit of crow's feet, and there was some acne scarring there, and the red outlining the fat pad. And you can see, even though the lighting is the same in this before and this 1 month later, that the fat pad has shrunken down. It's not catching the light the way that it used to, and that the skin just looks tighter, smoother, more lifted in the second photo. Here's another client, again, 1 month progress, single treatment with Agnes, and I'll show you a close-up of another one that's a little bit easier to see, but hopefully you can appreciate that the crepey skin and the drooping skin is improved in the bottom photo, which is 1 month progress. Here's our spa manager again, Jeff. He had some fairly protuberant under eye fat pads, but 2 weeks after his first treatment, you can see those have flattened pretty nicely. The skin is starting to pick up. It's not so deep down in the tear troughs anymore, and that's without doing anything else differently. And another client at 1 month after a single session, again, looking, if you can, at the crow's feet all the way around. You can see in the second photo that they're softer. They don't stand out as much. And I think we have a close-up of this to make it just a little easier. You can see the lifting in the skin here under the brow, and you can see a softening of the crow's feet. And again, that's just at 1 month after a single session, which is not the full result. Yet we usually call the full result at 3 months. but I like to put in the 1 month so you can see that even at that early stage, there's quite a bit of change that can be appreciated. So some people cannot have AGNES RF performed. If someone has a pacemaker or implanted defibrillator, we're not able to use the AGNES RF device because we have to use a grounding pad. If there's a metal implant somewhere in the treatment zone, that might cause a problem. If someone had a plate under the skin for some reason, had a trauma in the past, we would avoid using RF microneedling in that area. And someone with obviously any active underlying major medical problem, which is causing them to be quite sick and potentially have difficulty healing from a procedure, that might not be someone we would be eager to treat. So if AGNES may be a good treatment for you, if you're looking to smooth, tighten, or contour anywhere on the face, as you've seen, it's definitely a great tool for working in the tight and delicate areas around the eyes. But if we want to contour jaw lines, if we want to contour down here, a fat pad, it's been an excellent treatment. We've seen more result with AGNES than we've seen with many other procedures we've used to contour the jawline. So it's very exciting to see what it's capable of. If you're seeking a non-surgical intervention, certainly AGNES gives you that option. We have a lot of people who don't like their hooded eyes, but just don't feel like they are ready to get a blepharoplasty, which is surgical correction. So AGNES certainly is a good option for tightening that skin. You do have to have tolerance for some downtime. There is some swelling, which tends to stand out mostly around the eye procedures, because it's kind of hard to hide that. Jawline, it doesn't tend to be that big a deal, but you can imagine if your lids and under eye were puffy for 3 days, that would be something you might have to plan for in advance. It's possible you may get a little pinky smudge of a bruise somewhere. We try to have a no bruise technique, but every once in a while that happens. Again, if you have concerns about fine lines around your eyes and those concerns have not been adequately addressed by things you've done or may have done in the past, like filler or Botox, and AGNES is definitely something you want to consider. And as I mentioned, lines around the mouth, even necklace lines are a good target for AGNES. And we're able to treat acne as well, even cystic acne. We may get into that in a separate video another time. So preparing for an AGNES RF treatment basically simply involves confirming what areas you want to treat. We do some photos. We select a date for you. You would pay a deposit, which is usually 50% of the fee, in order to secure that date. For a couple of weeks before your procedure, you want to avoid medications and herbs as listed there that would tend to make you bruise more. I mean, it's not critical. If you have to take aspirin, you have to take aspirin, but you just need to be aware that you have a higher risk of bruising in that instance. And we like for people not to have any major social events for a week or two after a procedure like this, just in case their swelling hangs around longer than average. On the day of the procedure, we cleanse the skin, obviously. We mark it. We take some photos with the markings to document exactly the treatment zones. Lidocaine is used by injection to get the skin completely numb or as close to it as possible. And then the treatment itself is going to take anywhere from 15 to 60 minutes. It really all depends on how large an area, how many different needle types we're using, and how many zones we're treating. So we've had some people who have done eyes and jawline all at once. Then that's certainly going to be more of an hour-and-a-half procedure because now we're treating multiple zones. So we work that all out with you at the medical spa so you know exactly what's going on. And we go over your pre and post care with you as well to make sure that all of your questions have been answered. The whitening of the skin you see there is just that lidocaine effect. So I wanted to make that clear. That's not a permanent change in the skin color. And you can see on the right, again, a close-up there of what it looks immediately after. That's before any icing. And once the ice is applied, you don't see little needle depressions any longer. So additional treatment zones there. I mentioned the jawline. We'll talk about that more and look at before and afters for jawline in a separate video. We'll find another date for that. Still good? Mm-hmm. I hope you found that useful and interesting. This slide just has, again, the sort of AGNES team, myself, Heather, and Victor are currently performing this treatment most days of the week. And usually working with us is one of our procedure techs or medical assistants. And that's pretty much it. So if you have any questions about AGNES RF, please don't hesitate to contact us. So how long the results last depends on your rate of collagen loss. So by that, I mean, once we put collagen back, once we achieve smoothness, in an area that wasn't smooth before, let's say. The question then becomes, how long will it take? So how many years will it take you to lose enough collagen for that skin to get loose and crepey again? So if you're 70 years old, you lose collagen at a faster rate than if you're 37 years old. If you have a lot of sun exposure, if you smoke, if you just don't live a healthy lifestyle, you're going to lose collagen more rapidly than someone the same age who doesn't have those lifestyle issues, right? And then there's genetics. So I can't say for you individually exactly how long your result will last because we can't control a lot of those other variables. But as a rule of thumb in aesthetics, we usually say collagen, a new batch of collagen probably lasts 5 to 7 years, meaning it might take you 5 to 7 years, to have lost whatever collagen you gained from doing a procedure. So that's probably as close as I can get to an answer. And good question. I have a question. How does this compare to Sculptra in creating collagen? Sculptra is an injectable powder, actually, for those of you who may not be familiar with it. Sculptra is an injectable powder that we use primarily to volumize in the face, in the temples, in the mid-face, and also quite a bit in the nasolabial area. Sculptra is an injectable collagen stimulator, but it's very limited for what it can do to the skin surface. So Sculptra is more building collagen on the inside for volume or plumping, or what I call the mattress, to restore the mattress volume. Whereas AGNES enables us to create the collagen in the skin layer, in the dermis. So we can't inject Sculptra, for example, around the eye. That's completely contraindicated. So it can't help us there. And we don't use Sculptra to smooth forehead lines. We use it more for a plumping, or like I said, think of it like stuffing the mattress. If we want to smooth the sheet, smooth the bedspread, then we got to use a surface collagen building technique. And so for that, that's not going to be a Sculptra. That's going to be maybe the PDO Smoothing Threads, or definitely, AGNES radiofrequency microneedling of whatever device. Those are really your smoothing the sheet and the bedspread versus stuffing the mattress. I hope that helps. I hope I was clear too. The AGNES, depending on which needle we're using, we can tighten, we can surface smooth. We've been doing a lot of work with it actually on pockmark scars, on acne scars. Like you saw in that one picture, there were some pockmark scars here. It's doing a really great job, even in one treatment, in terms of remodeling scar tissue collagen. So where it's going to fall off is anywhere like off the face, because the handpiece is so fine, it would become too cumbersome to treat a larger area like an abdomen or something like that, because it would just be too time consuming. So its greatest use is going to be in small areas or limited to the face and the neck. Even the earlobe, tightening the earlobe if you've got loose skin there, that's something we can do with AGNES as well. And the number, we have a question about the number of treatments. Again, depends on how much collagen loss we're starting out with. A lot of people have really deeply etched crow's feet, deeply etched lines between the brows here, deeply etched forehead lines. So if it looks like you took a knife and carved it, that's probably going to be something that needs a couple of treatments, possibly even 3. If it's something where it's a crepiness, something not as deeply etched, like a fine crepiness, that could be done in 1 or 2 treatments, depending on how robust your skin responds to the energy and the microneedling. Okay, I have a question. Once the under eye fat pad is destroyed, will it come back? Fat cells that are destroyed in that area won't be regrown. Like we don't create really new fat cells in the under eye area. It's possible that the fat pad that's there with additional age might protrude more over time as you get older. So we can't stop aging, unfortunately, but we can undo the effects. So I would say, what we're usually seeing with the fat pad treatment is that we'll have that flattened out in 1 or 2 treatments. And at that point, that's going to last for years, unless, really enough time and enough facial aging goes on that, maybe the fat pad protrudes. What was left comes out a little more. We could just spot treat it or retreat it. But it's not something where you would be doing this every year, or even every 2 years, or even every 3 years. This is something that would have a a very long lasting effect. Plasma pen is a very different type of treatment. I hesitate to use the word treatment because I'm not a fan of plasma pen technology. But what the plasma pen devices in general cause is a surface burn by various mechanisms by creating this plasma. And I won't go into that. It's a surface heat. So they're basically causing a somewhat controlled burn on the surface of the skin. And if you've seen that online, you've seen these little brown eschar-like dots as they're doing it, because they're literally singeing, the skin, and then hoping that it doesn't scar, and hoping that it doesn't leave brown marks, and hoping that it heals and that there's actually collagen that's smooth left in its place. And that's a whole lot of hoping, let me tell you, because it is a burn. It is complicated. Clients who've come to Renew who've had it done somewhere else, because we clearly don't do it, every single one of them has said, the downtime was horrible. I would never do it again, and I don't see any difference. I mean, that's basically what I can say about that. My concern is safety, because they're burning the surface. With Agnes, the heat is only being delivered at the tips of the needles, and needles are completely inserted. So with Agnes, there is no burn on the surface of the skin. The heat is only at the tips of the needles, and it's only being delivered underneath that epidermis in the layer that can take the heat where the fibroblasts are that will create that new collagen. So it's a much safer procedure.